Hi everybody, I'm so sorry I wasn't able to join you. I hope you all had a great experience for your first externship placement. I know mine was great. I was at Holland Hospital Rehabilitation, which is an outpatient clinic separate from the hospital. I saw a lot of different clients from voice, cognitive, some swallowing, a lot of post-concussion, some aphasia, some dysarthria, varying degrees from mild to severe. Um, let's see, part of a team. We collaborated weekly with PTs, OTs, a case manager, sometimes a social worker, who all work on the same building and the same floor as I did. So there was about 8 physical therapists, 2 occupational therapists, and then my supervisor was the only speech pathologist. So our weekly meetings were bright and early, about 7 a.m. We kind of just discussed progress that the clients were making or lack of progress. That was our time to kind of formally see what they were doing in other situations as in OT or physical therapy. Since we all worked on the same floor, we had a lot of communication just throughout the day as well, as we transferred folders and binders and things like that, so we could kind of discuss in between clients how they did and any progress that was shown. So I would say that they were really big on collaborating, and it was a really great experience for that. The documentation, every time we saw a client, we usually saw them between 50 minutes to an hour. We had to write a daily note. They were really basic, just kind of what the patient had seen during the week, what we did, how that correlated to our long-term goals and short-term goals, and then kind of what we were planning to do for the next week. After a patient had been seen for 28 days, we had to reevaluate them for insurance purposes. And so our reevaluations were, different for each client. And then we'd have to follow that template for a reevaluation. We also had a template for a discharge, so it was pretty basic, but just kind of a lot of paperwork. What had challenged me? Probably the most challenging thing for me was getting used to having a really busy schedule. I started off my caseload and it was really slow, so I would only see about 3 or 4 clients a day with a couple an hour break in between, which is really nice because it's easy for me to get out my paperwork, plan before the session. It was just pretty relaxed, and then towards the middle, we started seeing like 8 clients a day, and that means you're just back to back. So we tried to end like 5 minutes early and quick get that daily note done. But a lot of times that doesn't happen between conversations with clients, questions they have, walking them back out to the waiting room, different things like that. So just kind of writing all the daily notes, writing the evals, writing discharges, just kind of all that in one day was kind of challenging for me, but you get used to it. Another thing that was challenging for me was getting comfortable and with like some of the voice clients that I had seen. I didn't have a lot of experience with voice clients, just a couple of evaluations at grad school, so it was really a good experience for me to kind of learn some of the techniques that my supervisor used, along with the busy pitch. I got a lot more comfortable with that. So my challenges were challenges, but at the end I think they weren't too hard and became easier for me to complete. So some descriptions of experience that have improved my skills and knowledge. I'm sure everything I did improved my skills and knowledge. I saw a lot of clients that I had never seen before, such as a lot of post-concussion. They had seen like just a huge incline of this from colleges and universities, as well as some high schools that were close to our clinic, and for some reason they just all came at one time. So we saw about 6 or 7 of those in the past couple of weeks, and I had never seen a client with post-concussion, so we did a lot of cognitive, divided attention, internal memory strategies, different things like that to help with them during school or at work or wherever their functional activities were. Other things that I improved, my ability to write notes and plan sessions in a quick, timely manner, just kind of communicating with families. We had a lot of family meetings, just due to different circumstances. Like we would meet with a family if they weren't making any progress. We had to kind of like tell a family maybe we thought they had some signs of dementia or things like that. We also saw a family member who, or family and caseworkers, when one of our patients had been in a bad car accident, so we were trying to move him from being at our rehab for 3 months, over 3 months, which is a really long time for our rehab, and then to move them towards like a, some sort of job that he might be able to handle and different things like that. So we did a lot of things like that as well. I'm pretty sure everything I did was, I learned a lot of knowledge and clinical skills. My supervisor was great. I had a great experience overall. Can't wait for my next one to start next week. So hope you guys are all doing great. Talk to you later.